Hello YouTube, this is Sam from Tiger Schooling. In this session of the video, we're actually going to talk about the anal canal. So the anal canal is actually the final segment of your gastrointestinal tract. It has an important role in defecation and maintaining fecal continence. And in this session, we'll be talking about the internal structure and the internal structure, outer structure, nerve supply, and everything related to the anal canal. So remember, first we'll be talking about the anatomical position of the anal canal. So the anal canal is located within the anal triangle. So this is your anal triangle, lower down there. If I use this pen and highlight in this green, this section down there is called, this triangle is called as anal triangle. So this down here you have got the anal canal. So you would be saying the anal canal is located within the anal triangle of the perineum between right and left ischial tuberosities. This is your right ischial tuberosity. This is your left ischial tuberosity. So it is the final segment of your gastrointestinal tract, and its length is around 4 centimeters. If you see this diagram, you will know that its length is around 4 centimeters. So remember, the canal begins as a continuation of your rectum and passes inferior posteriorly. You see that it is going inferiorly and posteriorly, a little bit posteriorly, and passes inferior posteriorly to terminate into the last part, that is your anus. And the next thing we're going to talk about is the anal sphincter. So remember, before telling you about the anal sphincter, which we have 2 in number, remember that except during defecation, the anal canal is collapsed by internal and external anal sphincter to prevent the passage of fecal material. It's the help of these 2 sphincters. They have 2 sphincters, that is the internal and the external sphincter. You can see in this diagram that the first one is your internal sphincter right down there, that is on the internal side, and the second one is your external sphincter right down there. So they are controlling the fecal material to move out, and when the fecal material is moving out, they are going to relax. So first talk about the internal sphincter. So remember that the internal sphincter surrounds the upper two-third of your anal canal, right down there. It is formed from the thickening of your involuntary circular smooth muscles in the bowel wall. And the external anal sphincter is a voluntary muscle. The internal is involuntary, the external is voluntary. And that surrounds the lower two-thirds of your anal canal, and so overlaps the internal sphincter, and it blends superiorly with the puborectalis muscle of the pelvic floor. If I add up the puborectalis right down there, you will get to know the second thing, which is, let me put the puborectalis right down there. So if I add both the puborectalis, now I'm going to explain this way. As I've added the puborectalis muscle, you remember this muscle puborectalis surrounding your anal canal. So at the junction of the rectum and the anal canal, there's a muscular ring known as the anorectal ring. So this muscular ring are called the anorectal ring, and it is formed by the fusion of internal anal sphincter, the external anal sphincter, and this muscle, which is called the puborectalis muscle, and which is palpable on your digital rectal examination. So if somebody is asking you what is anorectal ring, you will be saying it is formed by 3 structures, that is the internal anal sphincters, external anal sphincter, and your muscle, which is called as puborectalis muscle.